Okay. Hi, Erica. My name is Sarah. I'm a nurse practitioner student at Nebraska Methodist College. I'm here to do your neuro exam today. Is that okay?
Sure.
Fantastic. Erica is a well-developed, well-nourished 39-year-old female, and her vital signs are normal today. So, Erica, I'm going to get started with the cranial nerve testing. I'll explain to you what I'm doing as we go along. So first, I'm going to test the olfactory senses, and that's cranial nerve 1. What I'd like for you to do is sniff. Okay. Testing for patency of the nares. They are both patent. What I'm going to have you do is close your eye, and I'm going to occlude one nostril. I want you to tell me what you smell.
Coffee.
Okay. Now we're going to do the other side.
Peppermint.
Okay, excellent. Cranial nerve 1 is intact. Now we're going to go to cranial nerve 2, and I've got a Rosenbaum test. So what I'm going to do is, first we're going to test both eyes together. I want you to read the smallest line you can.
428,365 OXO3 6,320/40.
Okay, so visual acuity in both eyes is 20/40. Now I'd like for you to cover one eye up. We're going to be testing the left eye. Now again, read the smallest line possible. Tell me what you see.
428,365 OXO 6,320/40.
Okay, visual acuity on the left eye is 20/40. Now let's cover up the right eye. Or, I'm sorry, cover the left eye. We're going to test the right eye. Same thing.
428,365 OXO 6,320/40.
Okay, visual acuity in the right eye is 20/40. That is wonderful. So now we're going to test, we're going to look at the optic fundi. So I'm going to turn on this little device, and I'm going to shine a light in your eye and just go up really close here. It's going to almost seem like I'm touching you. I'm looking at the optic disc. I looked for the red reflex first. Looking at the optic disc, it's yellow to kind of a pale pink in color. I'm looking at the arterial and venous distribution. It looks normal. The optic disc has clear margins, and it's not clouded at all. I'm going to do the same in the other eye. So you're going to feel me come close to you, looking at the optic disc. It is pale yellow, kind of a creamy yellow to pink in color. Arterial and venous distribution looks normal. The optic disc has clear lines, and the cup is not enlarged, and I don't notice any shading. Now, what I'm going to do, I'm going to test your visual acuity fields. I want you to tell me when you see my fingers wiggling, okay?
That's the right,
Okay, good.
left, right, left.
Okay, wonderful. Cranial nerves 2 and 3 are intact. And let's see, what we're going to, this is called a near test. What I want you to do is, I'm going to hold this up in front of your face. I want you to look at it, and then look at the far wall. Look at the far wall. Excellent. Now, same on this side. And, okay, wonderful. Pupillary constriction is normal, so cranial nerves 2 and 3 are intact there. Now, also, what I'd like to do is test cranial nerves 3, 4, and 6. That's the oculomotor, the trochlear, and the abducens cranial nerves. And what I want you to do is follow my finger with your eyes. Okay, cranial nerves 3, 4, and 6 are intact. Cranial nerve 5 is the trigeminal nerve. And what I am going to have you do is clench your jaw. I'm feeling the temporal muscles and the masseter muscles. Those are intact. Now, what I'm going to do, Erica, is I want you to close your eyes and tell me when I'm touching you.
Touch.
And where am I touching you now?
That's on the
Okay. Cranial nerve 5, the sensory portion is intact. Now, I'm going to look for your corneal reflex. And what I want to do is, I'm going to touch your cornea. I just want to see your reaction. Okay, that's normal. We're going to do it on the other eye. Okay, great. Corneal reflex is intact. Now, also, I would like to test your pupillary reflex to light. So again, I'm going to turn this on and shine a light in your eyes. And I'm looking for pupillary constriction and dilation. So, and we're going to do the other eye. Okay. Pupils are equal, round, and reactive to light, direct and consensual. Now, I'm going to do a test called convergence on you, and I'm going to bring my, excellent. Convergence test is normal, and those muscles work appropriately, and that would be cranial nerve 3. So we're going to jump to cranial nerve 7 now, and what I want you to do is raise your eyebrows and furrow your brow, frown. Now, I want you to show me your teeth and smile and puff your cheeks. Wonderful. Cranial nerve 7 is intact. Now I'm going to test your hearing, and that's cranial nerve 8. And I want you to tell me what you hear. I'm going to occlude one ear.
Chardonnay. Whiskey.
Okay. Cranial nerve 8 is intact. Okay, now what I'm going to do is test cranial nerves 9 and 10. And that is the glossopharyngeal and the vagus nerve. So what I'd like for you to do, Erica, is swallow. Okay, no trouble swallowing.
Yep.
Open your mouth and say ah. Okay, that's perfect. The soft palate does rise and lower normally, and the uvula is midline. Now I'm going to test for your gag reflex. I'm going to put this in your mouth and touch the back of your throat. Okay, gag reflex is normal. So cranial nerves 9 and 10 are intact. Cranial nerve 11 is the spinal accessory nerves. I'd like for you to shrug your shoulders and down and turn your head from side to side. Cranial nerve 11 is intact. Now cranial nerve 12 would be the hypoglossal nerve. And what I'd like for you to do is open your mouth, stick your tongue out for me, and move it side to side. Okay, cranial nerve 12 is intact. What we're going to do now, Erica, is go to some coordination movements. What I'd like for you to do is take your hands on your thighs and move them back and forth as fast as you can. Okay, that is perfect. And what I'd like to do now is called a point-to-point exam. I want you to touch the tip of my finger with your finger, then touch your nose. Okay, perfect. Wonderful. Let's do it with the other hand. Touch your nose, and touch your nose, and touch your nose. Wonderful. Okay, so what I'm going to have you do now is tap my hands with your feet. Wonderful. That's great. And I'm going to have you stand up, if you would now.
Right, like this?
And come down. I want you to walk across the room as you normally would, and then turn around and face me. Okay, gait is normal, and movements are smooth and fluid. What I'd like for you to do now is called tandem walking, and that's heel to toe. Perfect. That is excellent. Tandem walking movements are normal. If you would, turn around and let's have you walk on your tiptoes across the room. Okay, excellent. Can you walk on your heels towards me? Those muscles are smooth and coordinated in movements. Now what we're going to do is called the Romberg test. What I'd like for you to do is just stand still with your eyes closed. What I'm looking is for any type of drift or abnormal swaying. Okay, Erica, that's great. Now what we're going to test is called pronator drift. I want you to hold your hands out, eyes closed. You're going to feel me tap your arms, and what I'm looking for is the normal raise. Okay, pronator drift is appropriate, and we're done with that. So why don't you, I tell you what, I want you to, let's do a shallow knee bend on each leg.
very flexible. Sorry.
That's perfect. That's perfect. Let's try it on the other leg.
Sorry.
Okay, nope, that's great. Okay, go ahead and have a seat. Muscle movements are smooth and coordinated. Now, what I'd like to do is test for muscle strength now. And instead of doing that, first what I'm going to do is look at your shoulders. In a normal clinic situation, I would take down the gown. I'm looking for muscle symmetry, the way the muscles are distributed. Muscles are similar. Muscle tone looks good. And I'm looking all the way down her extremities. So what I'm going to do, have you relax your arm. I'm going to flip this over and I'm extending the fingers and the wrists and moving that shoulder and elbow. Muscle tone is good. And go ahead and relax that wrist and let's move that, extending the fingers and the wrist. Okay, that looks good. I'm going to do the same with your leg. So I'm moving that. Okay, muscle tone is excellent in the lower extremities. Wonderful. Okay, now we're going to start with muscle strength. Now, Erica, what I'm going to have you do is try to bend your elbows, and I'm going to press down. You're going to resist me and keep trying to bend them. Okay, that's great. And try to extend them now. Wonderful. And I'm going to have you try to, let's see. I want you to try to extend your wrists, and I'm going to resist you. Okay, go ahead. Okay, that is wonderful. Now, what I'd like for you to do is take your thumb and your finger, and I'm going to try to separate these. Okay, that's wonderful. And also, I want you to spread your fingers. I'm going to try to push them in, okay? That's excellent. Okay, muscle extremity on the elbows, the wrists, the fingers, and the thumbs is all a 5 out of 5. That looks good. Now, we're going to start with your hips. What I'm going to do is lift your leg. I want you to press down, and we're going to do this on both of them. Excellent. Okay, I want you to try to lift now. Wonderful. Extension and flexion strength is a 5 out of 5. Now I want you to try to open your legs and close. Okay, abduction and adduction movements, the strength is a 5 out of 5. Now what I want you to do is try to extend your legs and try to bend. Okay, muscle strength on the knees is a 5 out of 5. Now what I want you to do is pull up with your toes. Dorsiflexion is good, and press down. Dorsiflexion and plantar flexion strength is a 5 out of 5. Now, what we're going to do is test your sensory muscles, or sensory nerves. So, Erica, this is sharp on one end and soft on the other. I want to show you that.
Okay.
Okay,
That's
and
sharp.
then that's soft.
Okay.
So, what I'm going to do is touch you in certain areas of your body. I want you to tell me what you feel, whether it's sharp or soft. Okay, shut your
Okay.
eyes for me.
That's soft. Sharp. Sharp. You can do that again. Soft.
Okay, and I'm going for the
Sharp. Soft.
okay.
Sharp. Soft. Soft. Sharp. Sharp. Soft.
Okay, wonderful. Sensory nervous system is intact. Now what we're going to do is called a deep tendon reflex test. And yeah, it's fine to lay down on this. Now, I'm going to make an X on your belly, and I'm just noting the muscle reactions to this. Those are normal. Now, I'm gonna okay. Erica, I'm going to have you sit back up
Okay.
now. That is wonderful. Now, let's do the bicep tendons. I'm going to grab this on each arm. Okay. Brachioradialis. And I'm going for the patellar deep tendon. Excellent. And let's do the Achilles tendon. Okay. Deep tendon reflexes are all intact. If I did notice any sensory problems, I would then test Erica for proprioception. I would do vibratory tests with a tuning fork. I would do graphesthesia, drawing a number on her hand to see if she could tell me what the number was. And I would do a 2-point distinction for movements and touch. If I noticed any problems with the meningeal nerves, I would test for Koenig sign and Brzezinski's, and I would look for winging in the scapula if I thought there was some atrophy there. And I think, Erica, this concludes our neuro test today. Thank you so much.
Sarah.